Hi, everybody. This is David Bibby, Legislative Chair for EFSOMA 2024. Just wanted to thank the committee members, colleagues from the association and from the board who participate in the Legislative Committee. This year, we're working on updates for Chapter 457, specifically things that are important to everyday clinical practice, like use of professional titles, use of evaluation and management coding for insurance billing, prescriptive rights that include explicit language for a formulary for injectables, use of ordering and referring for clinical labs and imaging. These are all elements that need to be clarified in Chapter 457 to provide some authority and some explicit permission around use of these things, as well as others that other concepts that need to be updated as well. It's been more than 20 years since any work has been done to modernize the language in Chapter 457. So this has been our project, and hopefully here in 2025, closer now to having the bill reintroduced and hopefully something that would be passed and signed by the governor in the spring. I also really need to express gratitude to the membership, the profession at large, patients, our industry stakeholders like business members. All have contributed mightily to drive up the reserves that we have in the political committee that's used to fundraise and provide campaign support for key legislators throughout the state. This summer has been a really busy time for us into the fall, meeting with individual legislators, those key legislators that are going to be on committees that hear language that's designed to modernize and update the statute. We had a chance to meet with about 25 legislators between August and the end of October. Even with the storms and some of the distractions we had, I really want to thank the membership, everybody that stepped up and took time to get out and make an appointment with their district legislator to let them know that we're introducing a bill to generate some interest around educating their staff and getting the legislature on board with some of these changes that we're talking about for the statute. It's been an incredible few months, and it's something that the state association cannot do effectively without support from the membership. So I really have to tip my hat to everybody that got involved and made time to do that. If you haven't had a chance to meet with your legislator yet, certainly between now and the end of the year, now that the election is behind us, it's time to make those district visits. You can call their office and just plan 10 minutes to stop by, introduce yourself, share a little information with them. Feel free to contact Ellen Teeter at the office, or you can contact me at the association for any additional details that you need. I'm happy to provide that for you. It's a simple 10-minute visit if you have the time and interest in doing that. It's tremendous support to the profession, to your own practice, and to the association. We're also working on a pay raise for acupuncture reimbursement rates. Here in Florida, the legislature is looking at a across-the-board increase for reimbursement rates under Medicare, Medicaid, and we're looking to make sure that acupuncture is included in that discussion, and we'll have more information on that in the spring. So with that, I want to say we're busy. Every month is a new challenge. Every part of the year is a new challenge, but the committee is always at work looking at ways that we can help protect and promote the practice, make things a little bit easier for you and your patients. Feel free to contact us with any ideas that you have, the things that you want us to focus on, and certainly your participation is always welcome. Not just the legislative committee, but there are about a dozen or so standing committees that the state association is always working on, various projects from advocacy to communications, insurance, various ways that we can help support practitioners around the state and our membership. So thanks again. It's been a pleasure serving as legislative chair for 2024. I'll be in the same role throughout 2025. And I'm grateful, as always, to the colleagues that support the committee and the profession and the membership. Thanks again for all your support. Take care.